Good morning, everyone. Oh, good morning, Jack. Good. All right, well, good morning, Queensland, and a big good morning to all of our Facebook Live followers. Welcome, and it's wonderful to be at the Brisbane Convention Centre, where it's our first day of the mass vaccination centre, and fully booked out today, 1,500 people. So that's fantastic news, and of course that's going to be ramping up over the next few weeks. So it's great to see the booking systems working well, the free parking here. Thank you to the convention staff, and that's what I want to see. I want to see Queenslanders come out and get vaccinated. Now, we have some excellent news today. So, first of all, we have 4 new cases, but they're all locally linked to that Indooroopilly cluster, which is absolutely tremendous news. They're all in home quarantine and they have not been out in the community. That is exactly what we want to be seeing. So well done, Queensland, and well done to everybody who's staying in that home quarantine. And remember, you can't leave unless you get that final piece of paper from Queensland Health to say that your home quarantine has finished. And I know it's tough on families. A couple of my sisters and their families, they're doing home quarantine at the moment as well. So our family's impacted, just as I know a lot of families across Queensland are. In fact, there are thousands of people at the moment in home quarantine. Okay, so we have 156 active cases. We've had 23,099 tests in the past 24 hours, which is great news as well. And in Cairns, we've had 4,476 tests. So that's tremendous news there. That was an increase from yesterday's testing in Cairns. 15,625 vaccines were administered by Queensland Health in the past 24 hours. So that's, of course, wonderful news. So who would have thought a week ago we would be in this position today? So well done, Queensland. It's absolutely tremendous. Now we've got some great news for Cairns as well. So for Cairns residents, the lockdown will end at 4 p.m. Thank you for coming out and getting tested. Thank you for doing the right thing. But because we've had a couple of those cases in Cairns, Dr. Young has asked if we can keep the restrictions in place that we have for SEQ. They will apply in Cairns now, just to make sure that we don't have any community transmission. So I want to thank the Cairns community in advance, because this is what now we're asking you to do, exactly what the 11 LGAs are doing down here in the southeast. And that will apply, of course, until Sunday, August the 22nd. So that's great news. And of course, the Cairns residents will also have to be wearing those masks, just as they do down here in SEQ. And of course, the high school students will need to wear masks as well. So that's fantastic news. And as I said today, we're here at the vaccination centre just to ensure everything's running smoothly. From all reports, it is. It's great to see that this is up and running. And of course, as we get more supply from the federal government, and if I can just remind everyone that the federal government is responsible for 70% of the vaccination of Queenslanders, we're responsible for that 30%. And as we get more and more supply that is due in September, and then of course through to Christmas, we'll be able to look at opening more of these centres across the southeast and across regional Queensland. So thank you, Queensland. I'm so proud. A week ago, I think everyone was worried about where we would end up with this cluster. Was our biggest challenge, and Queenslanders absolutely rose to that challenge, and it's through your hard work that we're in this fantastic situation today. And just as Cairns has done that as well, well done, Cairns. Every single person in the community needs to be commended. So I'll hand over to Dr. Young. Thank you.
So yes, excellent news today. 4 community-acquired cases, all in home quarantine during their infectious period, all linked to the Indooroopilly cluster. So that cluster does continue to grow as we expected it would, given the environments it's been in. So just to go through, the first case is someone who tested positive on day 9 of their quarantine, a person in their 40s who's a household contact of a Brisbane Boys Grammar School student. The second case is someone who tested positive day 10 in home quarantine, a teenager who is a student at Brisbane Boys Grammar School, but there are 2 other household members already unwell in that household who are confirmed cases. Then the third case is someone who tested positive day 8, a student at Ironside. And then the fourth case is someone who tested positive day 9, a student at Brisbane Girls Grammar School. So we now have 120 cases linked to that cluster. In Queensland overall, we have 156 active cases, and to date we've now had 1,929 cases in Queensland. The testing results down here in the southeast corner were superb, and they were even better up in Cairns. So congratulations to the people of Cairns. You've really supported your community coming out. Please continue to come out. It's so reassuring that we've only had those 2 cases. The reef pilot, who now we have definitively confirmed got infected on that ship that he piloted through the reef. I have the whole genome sequence results from New Zealand that confirms that. So he came into the Cairns community on the 23rd of July, which is why we've put some additional exposure sites up in Cairns. So please, everyone in Cairns, could you go and check the website to make sure you haven't been in any of those exposure sites. It's really important that you still come forward and get tested, and anyone in Cairns with any symptoms at all, as you've been doing the last few days so well, please come forward and get tested. But given that we've only had that reef pilot and the taxi driver positive, and we've had so much testing, I think it is safe to lift that stay-at-home requirement, but it's still important that we have those ongoing restrictions, and it's still vitally important that people continue, as they've been doing, to come forward and get tested. That is just so important in case there's been any other spread. The highest risk contacts are negative, which is very reassuring, particularly as we're so late in the infectious period for that taxi driver and the reef pilot. But we all know with this virus it can transmit. It can transmit to someone who doesn't have any symptoms, so doesn't know to come forward and get tested. So there's still a risk there. It's low, but it's there. So please just keep coming forward and getting tested. Similarly for the rest of the state, I genuinely don't know where this virus might next pop up, but it's so reassuring to see how well people have responded when it does pop up. But it's always important if we could try and find the very, very first case, because that means we can have a short, sharp lockdown and prevent transmission and all try and get back to our lives as quickly as possible. So please keep coming forward, any symptoms at all, no matter where you are in the state. Don't think because there hasn't been a case in that area of the state for a year that there couldn't be one. We all know there could. So please just keep coming forward and we'll be able to manage this beautifully, as the southeast corner has and as Cairns has. So thank you very much. Then today it is so great to be here, the first day of operation of this new mass vaccination clinic. I got my second AstraZeneca vaccine yesterday. I managed to get a badge. I'm sure I'm meant to be guilty because I don't know that we've got many of these badges. So I put that on because I'm so proud that I've been able to go and have my 2 doses so that I'm part of that 20% of Queensland that's fully vaccinated, and that's what we've got to aim for. We really and truly need to aim to get at least 70% of our eligible population, that is people 16 years of age or older, vaccinated as soon as possible, because that will protect us when we have our next outbreak, as unfortunately I'm sure we will, and means that we'll be able to manage outbreaks differently going forward. As soon as we've got 70% of our adults 16 years plus vaccinated, we'll be able to do things so much more differently. It'll be excellent. So that's important. Then there is another group I'd like to get vaccinated. That is children, because of the Delta variant, children 12 to 15 who have significant underlying diseases. So Children's Hospital is managing that process. It's really important that those children come forward and get vaccinated with Pfizer as soon as they're able to register and get an appointment. Well children, not at this stage. The ATAGI advice is that it's children who have significant underlying diseases. So you can imagine cystic fibrosis, lung transplants, children with significant disease. It's really important they are protected. So please, anyone 60 years of age or older, or anyone who's had a first dose of AstraZeneca, come and get your second dose from your GP or pharmacy as soon as possible. Anyone under 60, if you wish to get AstraZeneca, please go and speak to your GP. Otherwise, register online through the booking process as soon as possible, because I do not want to have a single vacant booking appointment available for someone to get Pfizer. So I need people to register. Today, all 1,500 bookings are full, which is fantastic, and we will keep on pulling people forward who have registered to make sure they get booked. Thank you very much.
Well, good morning. Today's a really exciting day in Queensland's efforts to battle the COVID-19 pandemic. I've certainly waited a long time to see this. Thousands of people able to get their COVID-19 vaccinations at mass vaccination hubs like the one here at the Brisbane Convention and Exhibition Centre. I want to congratulate the staff of BCEC and Queensland Health who've put together such a fantastic, smooth program allowing people to safely and conveniently get their vaccines. We've got continuing good news here in the southeast. Just a handful of cases, all linked and all in home quarantine for their entire infectious period. That's a fantastic result. There are thousands of Queenslanders still in home quarantine here in the southeast. Some start to reach their 14 days today, and then a big batch tomorrow as we approach that 14 days from when the outbreak commenced. It is really important that people see out their full 14 days. As you've heard, we continue to get positive cases around that 10-day mark, and so it's important to keep the full 14 days of quarantine. Incredible result in Cairns, more than 8,000 people tested, all coming back negative, meaning we can lift the lockdown now with some ongoing restrictions. And I can also advise that supermarkets have restocked most of their product lines onto shelves in supermarkets in and around Cairns, and so they're returning to a much more normal level of stock and service.
It's fantastic to be opening up this new mass vaccination centre today, the day that we hit 40% of all eligible Queenslanders have had at least one dose of a vaccine. But that means 60% have not had their first dose yet. So if you are 60 or older, please pick up the phone today and make a booking with your GP or a community pharmacy to get vaccinated. If you are under 60, jump online and register on our Queensland vaccination website, because you have to be in it to get it. So for us to be able to offer you a booking, you have to be registered in our system. And it's wonderful to see so many people registering, and to know that we filled 1,500 booking slots here at the Convention Centre really within 24 hours. It is fantastic. We want to get to 3,000 on the weekend, but of course that's subject to our supply from the Commonwealth arriving on Friday. But please, look at all of your options, go get vaccinated. If you live in a region, we have vaccination centres right across Queensland. Find your closest vaccination centre, a pharmacy or GP or Commonwealth vaccination centre. Don't wait, get vaccinated today. Can I say to Cairns and Yarrabah, thank you. You've done an incredible job, and that's why we're able to lift the lockdown at 4 p.m. today. But we need you to keep up that great work. You will now move into the same level of restrictions as what we have in the 11 local government areas down here in southeast Queensland, and that will apply until 4 p.m. on the 22nd of August. So please make sure you are familiar with those restrictions. That includes mandatory mask wearing, limitations on the number of people in your household, and also going back to 1 per 4 square metres, and of course make sure you are checking into every venue that you go to, so that if we do get a case anywhere in Queensland, we can contact trace you quickly. So that check-in app is still so crucial no matter where you're going, any venues. We all want to go out and support businesses again. We can support those businesses by making sure that we can stay open and stay safe, so you need to be checking in as well. Big shout out to our students and teachers and all the staff at our schools who have done such a great job in the first couple of days of now wearing masks in high schools, and of course our school staff in primary schools wearing masks. We thank you for doing that. That is helping ensure that we all stay safe and we reduce the risk of spread amongst our schools and in our communities. So we're so grateful for everyone. But of course, with that big milestone of 40% getting their first jab and 20% of our population with their second, that means there's still plenty to go. And we need people coming out, get vaccinated, of course, continue to come out and get tested. And it was really pleasing to see our testing numbers have gone up a bit over the last day, up to 23,000 again. Please keep coming out and getting tested if you are unwell, even the most mild of symptoms. We need you to come out so we can find if there's any cases in the community. We watch in sadness of what's happening in New South Wales. There continues to be, on average, one person dying from COVID every 3 days in New South Wales. We just can't afford for this virus to get into our community and spread. And I know that we're up to the task. Everyone continue to do the right thing, and we can do this together. Thank you.
I'll too start with Cairns. Can I say that we saw very pleasingly high levels of compliance in the Cairns and Yarrabah area. So firstly, a big thank you to the community out there for doing the right thing, but also to our police and partner agencies on the ground for executing that so effectively. In fact, we only saw 3 on-the-spot fines in the last 24 hours, so very good outcome there, and we see the results. On our road borders, we have increased our operations in that area, so 5,969 vehicles in total intercepted yesterday, 108 turned around, only 2 into quarantine, and 2 issued with on-the-spot fines. So again, very high levels of compliance from our community. Keep listening to the messaging. That can be an ever-changing area, as we know, with what's happening in New South Wales. So we'll stay very focused in that area. And again, a thank you to the police on the ground for operationalising that so quickly and effectively. Overall, enforcement has been reduced significantly, which is very pleasing. So only 10 on-the-spot fines yesterday and no arrests. And on the masks, we are seeing some very good improvement in that area as well. So under 100 masks yesterday, 98 handed out by our police across the state, and 7 on-the-spot fines. So we would like to see that continue, so in the end we don't have to hand any masks out. Thank you.
Thanks. Are there any questions?
Premier, the goal to get 3,000, my understanding is some clinics, mass clinics in Melbourne do up to 10,000. Do you think we're doing enough? Do we need to increase that to get to that target of 70%?
Yeah, well, what we have in Queensland, and as we talked about yesterday, we've got the ability that the federal government has helped set up in terms of people being able to go to their local GPs, and also to the health minister and the chief health officer have worked with the federal government to enable those pharmacies to administer vaccines. And because we've got that extra supply of Pfizer, we're now able to open this centre. So as we get more supply, then we can open up more centres.
And will you be looking at drive-through clinics eventually?
We will look at all options, because we know that National Cabinet has set very high targets of 70 and 80% vaccinations. I heard reports this morning that BBC News was saying that over 75% of people in the UK now have been administered with the vaccine. That's what we need to see here in Australia. So as soon as we get that supply, we can administer more vaccines.
Premier, we're hearing many people in Cairns are getting tested through private labs, and that's taking up to 3 days for the results to come back. Is it premature to lift the lockdown, given many of those results haven't returned yet?
We've been getting through those private labs each day, so we've been able to report on that. But what we do know is that the Cairns community has been coming out, and Yarrabah, coming out to get tested. And because of those strong testing numbers, and because we haven't seen any more infections in the community, we are able to lift that lockdown at 4 p.m. today. Now, that's not to say that Cairns and Yarrabah are out of the woods by any means. That is why those restrictions that are being put in place on these 11 LGAs in the SEQ will apply for Cairns up until that 2-week period on the 22nd of August.
Not the question for the Chief Health Officer,
Yeah.
but when are we going to start vaccinating those 12 to 15-year-olds with underlying health conditions? And when do you see that expanding to other?
Yes, so my understanding is that we're working through that with Children's Hospital at the moment. So they will be helping to identify that. That was a decision that came out of National Cabinet last Friday. It wasn't just before the state election, so that's not correct. And my understanding is that the issues around that were in relation to tourism and the impact that COVID was having on tourism. We know that the tourism operators were hurting right across the state, and it was sentiment testing on tourism and business. And other issues that were canvassed, my understanding is about people's wellness, well-being, how they were coping. As we know, COVID's had a really big impact on families, on people, on businesses. It's been huge. It was market research and sentiment testing, and no, it won't be released. Because every state and the federal government has also done the exact same market research and sentiment testing. We'll go and ask all the other state premiers and go and ask the Prime Minister. Yeah, that's right, and I've given the answer.
Was any of that polling or research shared with Labor campaign staff?
No.
Premier, Dr. Young just said once we hit 70% that lockdowns, 70% vaccination rates of lockdowns might be handled differently. What can you tell Queenslanders about how lockdowns might work when we hit that 70% figure?
Yeah, thanks. And there's a lot of work that's being done at the National Cabinet level, and of course the Prime Minister convenes those meetings every Friday. So we're getting the most up-to-date information from the Doherty Research Institute that's sharing that research and modelling with National Cabinet. But what we do know is that we need to see the vaccination rates come right up. You know, we know that the lockdowns do have an impact, but these short, sharp lockdowns are working. And even now the federal government is saying the way you combat the Delta virus is you have to have short, sharp lockdowns. And as we've seen, little did I think a week ago we'd be in such a good position here. And you only have to look at what's happening around the world. You only have to look what's unfortunately happening in New South Wales. You know, you cannot let this Delta strain run. So everything that can be done must be done.
But how will it change when we hit 70%? How would you?
They're working through all of that at the moment. So in terms of, they're looking at, for example, if people are fully vaccinated, what does that look like for people? What can they do? What sort of more freedoms could they be given? But there's a whole lot of work that's being done, and that's been put out in that 3-stage process that the Prime Minister released.
It's day 12 of mandatory testing today for people in that Indooroopilly cluster.
Yes.
And yet lots of testing centres are no longer allowing tests at those at the Western drive-through clinic. They're not doing tests anymore. They've drastically slashed staff from 12 to 4 in some places, and also Sullivan Nicolaides is refusing to test in some places. Is that premature?
Well, look, we're happy to look into those issues, but I know that it is day 12 for a lot of people, but they do need to go and get that test, and we'll work with Queensland Health to make sure that they do get that test done today.
There's a lot of outrage on social media about that this morning.
Well, I just ask people to please be patient. You know, this has been you know, a big ask of all of our staff. It's a big ask of families and everything. So look, please be patient and ring the Queensland Health Hotline if you do have any concerns, and we'll get to that. We'll get to you as quickly as possible.
In regards to that polling, you said yesterday that
research.
You said yesterday that you've seen some of it. Can you confirm today what part of that research you had seen?
No, because I've only seen very limited amounts of it. And like I said to you, I went through the issues. There were issues about impacts on tourism, impacts on business, people's well-being, and most of it went to, like I said to you, went to that COVID task force that was looking at, in terms of the health campaigns and the health messaging to the public, what was the messaging that needed. And just like they do in whether it's to do with transport ads or you know, community service ads, it just helped with that. I'm not aware of that. I'm not aware of that. I have not seen any of that. I'm not aware of any of that.
Can we ask Dr. Young a question?
Yeah, sure.
Yes, I've asked this morning where the family lives in New South Wales so we can work through what's required. Of course they can come into Queensland, then we'll just work through what type of quarantine might need to be in place. But I don't know where the family lives because unfortunately we got a different surname, so we were trying to find the information and couldn't, but now I've got the surname so we can actually check. So I understand they put in a request yesterday. I don't know. I need to know where they're from.
Dr. Young,
Is it appropriate that teenagers are getting access to Pfizer jabs at these mass vaccination hubs for older Queenslanders? And is that because of the high school cluster?
No, so anyone who is 16 years of age or older can get vaccinated with Pfizer. They just need to go and register and then we'll give them bookings. And it depends who's registered. So I need everyone to register because we are going to try, of course, to pull in the higher priority people, but I will never ever leave a booking slot vacant. So if we've got spare bookings and there's only teenagers who we can pull in, that's who we'll pull in. All of them.
No,
Yep.
do you know how many Queenslanders?
Oh, yesterday it was 50,000. I don't know how many from today. We haven't got today's numbers. But it's really important. Can I just say to everyone, please, I know it's a nuisance that you have to go and register to then be able to book, but that's our way of trying to pull the highest priority. But ultimately, I just want as many people who are 16 years of age or older to be vaccinated. And in actual fact, it's really important that younger people get vaccinated because we know they're more likely to spread. So we've seen the Doherty information that suggests we could get better results if we vaccinate younger people. So I don't actually mind that younger people are getting vaccinated. I think that's a good thing. But of course, we're always going to prioritise those groups that we've put out there.
Dr. Young, just on aged care vaccination.
We've seen some people who registered months ago still not getting a call-up compared to people who've just registered.
Yeah, I'm not sure about that, I've been told, and there's always going to be some glitches, which I apologise about, but we are working through all of that to try and make sure that the people who've had their names on the list longest get done first.
Just on aged care vaccination, Dr. Young, I know
Yes.
it's a federal government responsibility. That rollout started 6 months ago. The figures at the moment are that 83% of residents in aged care facilities are fully vaccinated. I'm just wondering how you feel about that rate. What rate do you think we should be at by now? And also one facility we've found in Toowoomba is at a rate of only 51% fully vaccinated. How concerning is it for you that they're still only at that rate 6 months on?
I'm very, very concerned, so I would like to see every single resident in aged care fully vaccinated, but it's their choice. Remember, that is their home, that's where they live. And if they have chosen not to be vaccinated for whatever reason, that is absolutely their choice. Now, we are mandating, and National Cabinet made this decision, that as of the 17th of September, and I definitely want to see it before then, that anyone who works in aged care must have had at least one dose of the vaccine, and we're monitoring that. Now, for our Queensland Health aged care facilities that we run, we are really strongly managing that and pushing that out. So I do plead that every single person who works in one of our aged care facilities anywhere in the state, if you haven't already, come forward and get your first dose and get your second dose as soon as you're able to. 8 weeks after the first dose for AstraZeneca, 3 weeks after the first dose for Pfizer.
Will you be issuing a public health order for that?
I already have.
Oh, you have?
Yes.
Fake mask protection badges are being sold online in Queensland as buying them, so but we do have genuine conditions.
Look, as the Chief Health Officer has said, I mean, for those who are so vulnerable that they can't wear a mask, they should think about whether they should be moving around the community a lot anyway, just for their own safety, particularly while we're still at this heightened level of restrictions. But it's really disturbing to hear that. People shouldn't be trying to find ways to work around the rules. I mean, this is about keeping them safe, as well as the broader community. If you don't have a mask on, then you are risking yourself getting the virus. So it is not worth trying to come up with a fake excuse not to wear a mask. If you've got a genuine reason, then that is fine. And we've said this before, and I'll let the Deputy Commissioner speak about this as well. We're not expecting businesses to, become police officers and direct people that they must show proof. But we do ask for common sense. We do ask for people to do the right thing, because they're putting themselves and the community at risk by just flaunting the laws around wearing masks. And having said that, can I say, wherever I go, the majority of people are doing the right thing. They're wearing their masks, and we thank them for that. There will always be a small percentage who don't want to comply, but there will also be a small percentage who can't. And we should respect that, because there will be some people who can't wear those masks. So I'll ask the Deputy Commissioner to speak about it.
Thank you, Minister. Look, really simply, my advice would be don't waste your money on the lanyard, firstly. Secondly, that people who have a genuine medical exemption have nothing to fear, nothing whatsoever to fear. We will work through with that, and we will not take any action against anyone that has a genuine exemption purpose. As you've heard, the advice very clearly from the show, which I thought was a really sensible one, really think about whether you're out and about when we need to be wearing masks when you have that kind of exemption. And for those people that are willfully trying to pretend that they have an exemption when in fact they don't, just so they don't have to wear a mask, they're the ones that will investigate and take the appropriate action if needed. Thank you.
How do you see these mask requirements going for, I guess?
Till next Sunday. If we get on top of this cluster here and up in Cairns, that's the plan at the moment. But we need to keep them and have them ready so that, unfortunately, when we get our next outbreak, because it is going to happen, of course it's going to happen, that we can immediately get hold of them.
Update on people with COVID in hospitals. Is anyone in ICU, and are any of them children?
So today we have 59 people in hospital, 92 in hospital in the home, so they're being managed in their own home remotely, and one person in ICU who's not ventilated, and that person relates to the Portuguese cluster from a while ago. It's not related to this current cluster. We don't have any significantly unwell children. No, the masks are so important. I can't stress it enough. They're really, really, really important for the Delta variant. So last year at the start of the outbreak, there was a lot of concern about fomites and problems with how people would manage masks and how they'd use them. We now know that it's actually that physical barrier that as you breathe out, it traps the virus, and if you're on the other side, you then have that double protection of that person who's there engaging with you, who might have the virus, who's breathing in, and you're breathing in. They work. They are really, really, really good. So please, I know they're awful, I hate them. And I'm sure I go home at night with a dry throat because I've been talking all day through them. And I'm sure that that's the case with the teachers. And I do sympathise, I really do. But it's important. And for teachers, please avail yourselves of the vaccine. It's been made available to you, because we now know with the Delta variant, kids are particularly at risk of getting it and spreading it. So kids are likely to spread it to teachers. So teachers, for your own sake, please wear the masks. It's really important for your sake. I don't want any more teachers getting infected with COVID, because you're at much higher risk of getting severe disease than the children are. Thank you.